Sampling methods are classified broadly into two types. One is probability sampling, the other one is non-probability sampling. What is the difference between both? It's very simple. Probability is every sample will have a proper statistical methodology involved in it, and selection of sample will be according to some proper systematic methods. For an example, it will be according to some random or certain methods would be used to pick the sample in probability. In non-probability, there won't be any kind of statistical or there won't be any kind of methodology involved. It will involve just your convenience. You can take that sample according to your convenience and criteria. So that is the difference between probability and non-probability sampling. In probability sampling, because it follows certain set of rules, the chance for getting selected as sample it will be equal, or it will be the chance for getting selected from the population will have a methodology which is more or less equal for everyone. But when it comes to non-probability sampling, the chance to get as selected as a sample is not equal. It will be according to its own convenience. So that is called as convenience method, and this is a random method.
Before moving on into the types of sampling technique, I'll tell you what are the advantage of sampling. First, it reduces the cost of investigation, the time required, the number of personnel required. For example, when you do a study, you first take the geographic area or the geographic population, and from that you select your final sample. If the sampling technique is not there, just imagine how can you do a study on all the population, the geographic area. That might be cost effective, and it is also might be time consuming, and the number of personnel involved might get increased due to we can't draw a final sample. Second, it allows thorough investigation of unit of observation. If we do a study on the geographic population, it's very difficult for us to do a thorough investigation of each and every unit. But by this sampling technique, we systematically or we randomly select, and they will be a representative of the whole population. So this is one of the advantage. Third, a sample can be covered more adequately and in more depth that can a total population. A sample can be more adequate, but that when you do a study on the whole population, it might not be adequate. So this is the main advantages of sampling. Types of sampling technique. As Sir told, there are two types of sampling which is broadly classified into probability sampling and non-probability sampling. Probability sampling, as Sir told, every one will be the representative of the whole population, and each representative will have equal chance of getting selected into your final sample. Whereas non-probability sampling is no equal chance will be given to each representative to select in as a final sample. That is the main difference between probability sampling and non-probability sampling. Now the types of probability sampling. There are 6 types of probability sampling, namely simple random sampling, systematic random sampling, stratified sampling, cluster sampling, multi-stage sampling, multi-phase sampling. Whereas non-probability sampling may include judgmental sampling, quota sampling, convenience sampling, snowball sampling, haphazard sampling, expert sampling, model instance sampling, diversity sampling. I'll just give you a gist of the probability sampling. I'll just give you few lines before you move on to the original concepts of each and every type. First is simple random sampling. As the name suggests, it is a simple method which is subdivided into lottery method and table of allowance method, which will be discussed in further discussion. Next is systematic sampling. As the name suggests, your protocol will follow some systematic number, some nth number to reach your final sample. Next is stratified sampling. As the name suggests, you divide your samples into stratum, and from stratum you select the sample. Next is cluster sampling, where you divide your samples into cluster, and as a whole cluster you select into your sample. The fifth is multi-phase sampling, where your treatment will proceed into phases. Your sample selected will proceed into phases of treatments to reach the or to improve their overall oral health status. Next is multi-stage sampling, where you divide into stages. For example, from India it is some districts, from districts it's some places like that. You divide into stages. Your sample gets divided into stage. Next is non-probability sampling. Non-probability sampling, as I told before, all the representative will not get equal chance of selecting in a sample, which goes on. Judgmental sampling is as we experts will select the samples, select samples as the final sample. Quota sampling, as we have quota in a final year, like that quota, we should achieve that quota to extract a final sample. Convenience sampling, according to our conveniency, we select the sample. Snowball sampling is, it's like roll a die so that each and every person who hit the die gets selected. I'll explain this all in detail in your future discussion. I'm just telling just one line about to understand the whole concept into it. Haphazard sampling is you randomly haphazardly select according to your conveniency. Expert sampling is, you select the expert in the field of research which you perform, and from them you select the sampling. Nodal instance sampling is you select bright students. For example, you do a study on to assess the quality of NEET among the 12th standard student. You select bright students and do the study. Means nodal instance sampling is you be a unique feature from the whole population. Diversity sampling. Here, this is a type of sampling where you deliberately choose members so that all your views are represented. However, those views may or may not be representative proportionally.
Simple random sampling is nothing but every member of the population has equal chance to get selected in the population. So how every member will have an equal chance? There are two sub methods in simple random sampling. Simple random sampling is nothing but you are going to select every member in a random allocation method. So what are those two things? One is lottery method and the second one is table of allowance method.
Lottery method. Lottery method is one of the main type of simple random sampling where you take a sheet and write, for example, from 1 to 50 of the class roll numbers of students, and you put it in a hat and assign roll numbers like I told from each 1 to 50 to each student. Then tell them to pick a piece of paper. You draw 15 numbers from the hat. Your example, it might be any even number or odd number, any random number, or from 1 to 15, anything as such. So, taking or selecting your sample, final sample from a lottery, from picking up a lot is known as lottery method. Whereas a table of allowance method is nothing but you put a table where random numbers are present, and from that random numbers you randomly select a number. Okay, before that you assign these random numbers to each and every representative of your whole population, and from that you randomly select. That is known as table of allowance, which means you put a table, you draw random numbers, you assign it to each sample, and then from them you select random samples. That is known as table of allowance method. So in simple random sampling there are two types of method. Lottery method, you pick up a lot and select the sample. Table of allowance method, you create a table, assign random numbers, and from the random numbers you randomly select your samples, which is your final sample.
Now, in simple random method, we are going to discuss about the merits and demerits of simple random technique. So coming first to merits, the first merit is it is very easy and it's the most commonly used method in sampling. Second, it doesn't deal or it doesn't need the subset characteristics like age, gender and geography. Third, it can be applicable for the whole population and analysis is very easy. After picking up the sample, the analysis of the result is quite easy. Coming to the demerits of this simple random technique, first, it is very expensive for the whole population. Second thing is, it cannot be a true representative of the whole population because it doesn't involve the subsect details into that. Third, no additional or auxiliary information is used in this simple random technique. So these three are the basic flaw or demerits in simple random technique. Next, moving on to systematic sampling. What is systematic sampling? Systematic sampling is nothing but you are going to select the nth number of the whole population. For an example, if population is between 1 to 100, if you are going to fix that every seventh number you are going to systematically select. So first will be the 7, second will be 14, third will be 21. So the nth number, if you fix at 7, it will be 7, 14, 21 and etc. till it reaches 100. In simple words, you are going to select every seventh member in that population. This is called as systematic sampling.
Now let's move on to the merits and demerits of systematic sampling. Now what are the merits? First, the samples to be drawn is very easy to draw without any mistake. Why? Because as we select the nth number, it is quite easy for us to draw samples for our final study. Second is more precise than simple random sampling. Why it is more precise is that in simple random sampling, you need to get a data of all the persons, at least their registration number or at least their number, to select from them randomly. But here, since we select it by nth number, systematically it gets selected. This is more precise when compared to simple random sampling. Third, more evenly distributed. As we select the nth number, the distribution among the sample is so even. Coming on to the demerits. Here, if list has periodic arrangements, then sample selected may not be an accurate representative of the entire population. What does this mean? For example, you are doing a study among the smokers. Now, you divide them into, according to Fredestrom nicotine dependence scale, you divide them as low dependent, moderate dependent, high dependent and very high dependent. What do you do? For the category of first mild cases, you put them in periodic arrangement. For moderate cases, you put them in other periodic arrangement. Like that, if you select the nth number, for example, all the third individual comes under mild Fredestrom nicotine dependence scale, means that might be a flaw because here the list, if it's arranged periodically, the sample selected might not be a representative of the whole population because there are 4 grades, but you select all the individuals into only one grade. So here comes the flaw, which is a very important demerit of systematic sampling.